Hello, my name is Angela Cornett, and the focus of this presentation is depression and transcranial magnetic stimulation treatment, or TMS. TMS is a non-invasive treatment that is used to help with various mental health issues, including major depressive disorder, or MDD. To be honest, I had not heard of TMS until a close friend who suffers from MDD had started the treatment. The difference that it made for her has literally been life-changing. One of the Healthy People 2030 objectives is to increase the proportion of adults with depression who seek treatment. Patients suffering from major depressive disorder can sometimes become discouraged by the number of medications and treatments that they've tried unsuccessfully and may stop seeking treatment altogether. The theoretical framework I've used as a basis for my review is Sharon Dingman's caring model. One of the recommendations that she mentions in her caring model is patient satisfaction outcome data require consistent sharing with staff members, managers, physicians, and the Board of Trustees. Until the efforts for improved satisfaction outcomes are owned by everyone in the organization, fluctuations in the ratings will continue. This, along with other recommendations, highlight the importance of communication and continuing education to meet and even exceed the patient's needs. In Hosanna Zeta's group 2024 systematic review and meta-analysis, they found that the standardized mean difference of Hamilton Depression Rating Scale 17, or HDRS-17, varied based on the number of treatment sessions. Patients receiving 10 or fewer repetitive TMS sessions showed a mean HDRS-17 reduction of 2.6 units, while those receiving 11 to 20 sessions showed a mean reduction of 0.28 units. This meta-analysis demonstrated the efficacy of a repetitive TMS in reducing depressive symptoms in MDD patients. In a 2022 randomized controlled trial, Kipnar and others found an overall reduction of depression. As a result of this study, 63% of the treatment-resistant depression patients responded to TMS treatment, 15% partially responded, and 42% reached remission. Testamir and his group performed a qualitative study in 2023 to gain insight into depression patients' personal opinions regarding the TMS treatments that they received. The results were positive in favor of TMS, but the study noted a need for all staff to be more educated regarding the procedure, which brings us back to Dingman's caring model, highlighting the importance of communication and education. In order to implement the TMS treatments, there are very many different factors that must be addressed. To begin, it would be beneficial to reach out to nearby facilities that perform TMS treatment to better determine costs and timeline of events, including training of staff. A questionnaire should be prepared to help identify potential patients to participate in TMS treatment. Once the groundwork is laid, then a meeting with the Director of Nursing to explain the project and discuss approaching the rest of the treatment team, along with potential locations within the facility that could house the TMS equipment and staff. Following the approval of the Director, email invitations or phone calls should be sent to the treatment team with date and time and briefly mention the TMS treatment. Upon meeting with the treatment team, handouts, fact sheets, and copies of patient questionnaires will be given to team members to assist with education during the presentation. While retrieving supplies and setting up the treatment facility, staff will be utilizing TMS questionnaires to select patients for treatment. Once patients are selected and treatment setting and staff is complete, a date and time will be set for the treatment team to revisit goals of treatment and plans for further implementation, as well as answer any other questions that may have arisen. Once all issues have been addressed, treatments may begin as planned. Following each treatment, the patient's answers to questions from HDRS-17 scale, along with data from personal interviews with willing participants, are documented. These answers will include key groups such as sex, age, level of education, etc., which will be updated following each patient meeting. During initial launch, treatment team will meet daily to review any questions and incidents that may have surfaced. Following initial launch, team will meet weekly to go over data and review results. In line with Dingman's caring model, during the weekly meetings, staff will review education about treatment and address any deficits in patients' care. Gaining approval and obtaining supplies is the timeliest requirement because it depends on many different factors. It could be a matter of weeks or even months. Once supplies and approval are gained, the timeline should be more streamlined. For this presentation, I'm using 1 month to suffice as a time frame for the approval and location setup with supplies. Following that, weeks 1 and 2 will be finding appropriate candidates for the treatment using the questionnaire provided and the guidelines regarding exclusionary findings. While locating patients, staff will be educated on processes and the expectations in terms of treatment of the patients. Weeks 3 and 4 will be the actual TMS treatment of the patients, and using the HDRS 17 scale, staff will get patients' perception of the effectiveness of the treatment. If the participants are willing, staff will interview the patient using questionnaires designed to get more information about the patient's understanding of the entire process. During this time, staff will meet daily prior to the first appointment and following the last appointment to address any issues that come to light. Week 5 and following, the staff will meet once weekly to discuss treatments and review any new insights that have presented. In conclusion, I believe that this concept of the TMS treatment follows well with what Dingman intended with the caring model, as this plan keeps the patient at the center of treatment and continues to strive to maintain that. Thank you.